Working for Your Health, sponsored by HCA Virginia.
The pain and discomfort associated with a hernia sends thousands of people to their doctor each year, but the fear of surgery often keeps people suffering in silence. Now, medical breakthrough in robotic surgery is giving patients peace of mind for a painless and faster recovery. Our Tracy Sears is working for your health.
Thanks to robotic technology, Dr. Mukong Adeso is performing a surgery that was once painful and often resulted in a slow and difficult recovery. Today, hernia repair surgery has patients back on their feet in a matter of days.
It's a life-changing thing. You no longer have the issues with a hernia.
A hernia happens when an organ breaks through a tear or weak spot in the tissues that surround it, resulting in a small bulge. Common areas include the groin, belly button, and previous surgery scars.
Over a lifespan of heavy activity, coughing, sneezing, lifting, you always have this push against the abdominal wall. And in men, our groins are naturally weak spots. So over time, we can get weaker and weaker and you end up with a defect.
In years past, doctors performed open surgery or standard laparoscopic surgery to repair a hernia. But robotic technology now allows surgeons to perform hernia repair through tiny incisions with increased precision because of three-dimensional images that surgeons can now see inside the abdomen. Dr. Adeso says many of his patients are home the same day.
Recovery is quicker. There's less pain, less chance of infection. You go home quick. You are back to work quick, and then you use less pain medication.
Working for your health, I'm Tracy Sears.